Hi, everyone. My name is Shannon Ball. I will be presenting today. Thank you all for registering to attend. We were really happy to see the interest in the community on these topics. And in the future, we would definitely like to have more of these kinds of workshops. Um, and I apologize about the technical difficulties that we had yesterday. So we decided to pre-record, and Jenny will be sending this out to you all with some follow-up information as well. So I'm just gonna share my PowerPoint with everybody. Okay, and we'll get started. So today I'm gonna be talking about bereavement, COVID-19, and the impacts that we've seen on hospice care. So just some housekeeping. I already mentioned that this presentation is being pre-recorded. We were planning on having some questions and discussion following the presentation when it was live. Instead of doing this, we're going to set another date to go over questions, have our discussion live. So Jenny will follow up with everyone and let you all know when that will be taking place. As I'm presenting, if you guys have any questions, please take note of those questions and we will follow up on those during our next live chat. So welcome to everybody. So I'll just go over my role here at Cornwall Hospice. For those of you that don't know, Carefor Hospice Cornwall is located here in Cornwall, and we are a 10-bed residential hospice care facility here. So we have 10 beds residential, and along with this, we also offer a lot of community supports to anyone with a palliative or life-threatening diagnosis. We offer support to them and their loved ones and their families too. So my title here is Patient and Family Supportive Services Coordinator. I started working for the hospice in November of 2018. To start off, my title was the Program and Volunteer Coordinator, and I've been in my current role of Patient and Family Supportive Services Coordinator for about a year and a half. A little bit about my education background. I have a degree in thanatology. That's a 4-year degree through Western in London, Ontario. And thanatology is the scientific study of death and the practices associated with it, including the study of the needs of the terminally ill and their family members as well. I also have a degree in sociology. And after I completed those degrees, I went on to do my social service worker intensive through Algonquin College. And I'm a part of the Ontario School of Social Workers and Social Service Workers. So today we are going to be talking about grief bereavement, impacts of COVID-19, the implications that it has had on hospice and palliative care. And like I said, questions and discussion, that date is to be determined, and we will let you know. I think Jenny will send you all an email informing you of that date. So to start off, we will just talk a little bit about grief in general terms. So grief is a normal and necessary reaction to a death or a loss in a person's life. So notice that it's not only death where a person experiences grief, it's also non-death loss. Loss in general creates that natural reaction of grief. People who are grieving find it can be very difficult, stressful, and tiring. This is a natural process of grieving. Grief helps us to adjust to a new life without the person who has passed away. And it does not mean letting go or forgetting the person that has died. Very important to integrate remembering and creating that meaning through the life that that person had, and continuing that on for the person who is grieving. So it's not just about letting go and moving on. It's the combination of learning to adjust to that loss, to cope, and to also remember the person who has passed. Previous experience with death and loss impacts the way that people grieve. If people have had multiple losses, that definitely impacts the way that people grieve. If a person experiences a loss where it's the first meaningful loss in their lives, that can really be a big struggle for people. But if people have had multiple losses, that can also kind of complicate the grieving process. A lot of the times when someone passes away, it will bring back a lot of emotions and memories of previous losses they've experienced. But if people have had multiple losses in the past, it can also be a tool to help them cope and build resilience from those past experiences as well. Grief is impacted by cultural and spiritual aspects, practices, and beliefs. If a person is religious or spiritual, that can definitely impact the way people process death and grief. If people believe that there is an afterlife, that can be a source of resilience for people. At the same time, if people don't believe in an afterlife or don't follow any spiritual or religions, that can be difficult for people, wondering if they will ever get to see their loved one again in an afterlife. And cultural and religious communities also provide a lot of support for people as well. So grief and loss is a universal experience. These are experiences that everybody will go through at some point in their lives, and multiple experiences of loss will occur throughout our life journey. Despite grief being universal, it still is very stigmatized. People are uncomfortable with death a lot of the time. People are uncomfortable supporting people who are grieving, and a lot of this is because there's no quick fix to grieving and to loss. There's no way to bring back the person that has passed. And a lot of people, when comforting grieving people, they want to find that quick fix. They want to find a way to make the person feel better. And it can be very difficult to know that there's no quick fix to these situations. And also, grief is a non-linear experience. If you take a look at that picture there, it says how we want grief to work and how grief actually works. So there's a lot of ups and downs in the grieving process. It's non-linear. There's going to be struggles throughout. And a lot of the time, people who are grieving get very frustrated by this because they may feel like they're finally adjusting to the loss. And all of a sudden, they could have a really difficult day, a difficult week, a difficult month. And a lot of the time, this is attributed to reminders of the loss, to anniversaries that come up, the person who passed, if their birthday or the holidays. People find this very hard, and it can kind of bring back those really intense emotions that grief can bring. So how does grief affect people? So it's important to note that all people grieve differently. Grief is a unique experience for everybody, and I like to compare it. It's as unique as the relationship they had with the person who passed away. So most people feel shock and numbness in the beginning, and painful thoughts and feelings usually follow this. So the amount of shock and numbness, this is definitely impacted by if the death was sudden or if it was anticipated. But even if the death was anticipated, these feelings of shock and numbness usually occur. There's as much as we try to prepare for the loss that takes place, it's very difficult to know what to expect until that loss happens. Thoughts of confusion, disbelief, and wondering if this is just a dream. So a lot of people describe the grief as almost a grief fog, um, unable to focus, their memory is impacted. People just feel like they're unable to operate at the full capacity that they were able to before the loss occurred. And this is completely natural. Feelings of sadness, anger, guilt, loneliness, bitterness, fear, edginess, nervousness, short-temperedness, and lack of confidence. So a lot of these people grieving will experience all of these emotions at different times. And these feelings range with time. A lot of different emotions take place when someone's grieving. People who grieve may cry a lot or not. It's important for those people who may not display their grief, they may not show a lot of those emotions in public, to not assume that these people aren't struggling still. People who grieve may blame others. This is a time where families experience lots of stress, lots of crises. So family tension can occur sometimes, blaming other family members, sometimes blaming people in the medical system, feeling like the person's illness wasn't identified as early as it should be. Those experiences can often lead to feelings of blame. Also, people may withdraw from normal activities. And there's also physical symptoms associated with grief, such as problems sleeping, resting, eating, not having any appetite, or also some people tend to overeat as a coping strategy. Completing small tasks become very difficult. Things that we used to be able to accomplish no problem become huge obstacles, huge challenges for people. And they also may feel like they have no energy and experience cognitive effects. So lots of people after a loss, they return back to work and they just feel like they can't focus on anything. They're unable to complete these tasks that they were able to before the loss took place. So I really like this picture, a tangled ball of emotions, because it goes over the range of different emotions that people experience as they grieve. And if you notice, denial is right in the middle, and this is often the first initial reaction that people have, either when finding out that their loved one has a terminal illness, people don't want to believe that it's true. The person who has been diagnosed with a terminal illness may also start off feeling denial. If you look at the other emotions going on, lots of anxiety, bitterness, guilt is huge. Almost everybody that I talk to for grieving support experiences some guilt. Regret, abandonment, helplessness. So just take a look through these different emotions and just know that people experience these and they experience multiple emotions throughout the grieving experience. People who grieve find that grief goes on much longer than they imagined. It may feel like being on a roller coaster. Feelings come and go unexpectedly, and a lot of this is also attributed to these reminders that we talked about earlier. An example of this is a person driving and maybe their loved one's favorite song comes on the radio. And of course, this kind of brings back all of those memories of the loss and can be very difficult for people. And this realization that grief goes on much longer than they imagined can often be very frustrating for the people who are grieving. They wonder, when are these feelings going to end? When am I going to start feeling better? So it can be a big challenge for people to come to this realization. So there are no quick fixes or ways to just solve grief quickly. It's a process and it takes time. Each person must work through their own grief in their own way. And it is not easy for others to help a lot of the time. Often they may wish to, but do not know how. And again, this goes back to people want to fix these problems, right? And a lot of the time, there is no quick fix. People find that grief lessens with time, that grief helps the person to cope with the death, and the grieving process begins before their loved one died. So we call this anticipatory grief. Oftentimes when a person is diagnosed with a terminal illness, that grieving process starts for them and their loved ones right at that point, because that's when the loss becomes real to them. They start thinking about the future, and those emotions of that grief brings on happens before the person passes. So people can also grieve non-death losses as well. And a good example of this is ambiguous grief. So I'll just read this quote. "There are times in life when someone we love becomes someone we barely recognize. The person is still physically with us, but psychologically they are gone. There are a range of reasons why this can happen. Some of the most common are things like addiction, dementia, traumatic brain injuries, and mental illness. If you've never lived through loving someone in such a situation, this can be very hard to understand. The person you love is still there physically. Sometimes they look sick, sometimes they don't. But regardless of how they look, they do things they would never have done. They say things they never would have said, treat you in ways they never would have treated you, and they are not there for you in the ways that they previously were. This is sometimes referred to as ambiguous grief or ambiguous loss. So these are living losses. And I think the example of someone with Alzheimer's and their family realizing that they're starting to not recognize the family members, these create really challenging situations for families to cope. And the grieving still takes place even though their loved one is still with them physically. So some other examples of non-death loss and grief. Non-death loss and grief is connected to the subjective meaning or value that we attach to what is lost. These losses are things that are important to us, and there is either the belief or the actuality that things will never return to the way they were before. So some examples of non-death loss and grief: loss of a relationship. I've had a lot of people lose really close friends that they might have had for years. That loss of a person that they feel they could tell anything to. So that creates a lot of grief for when those friendships are lost. Going through a really meaningful breakup, all of these create grief. Other examples: adoptions that don't go through, loss of possessions. So an example is a house fire, losing all of your meaningful possessions that you have, loss of your home country, loss of safety, independence, or years of your life to abuse or neglect, and also loss of mobility or of health. And those are a lot of the losses that we have to deal with working in palliative care. So just some other types of losses that can occur. So losses can be physical for people, relational. When relationships are impacted, that creates a lot of challenging emotions and grief. political losses, losses of power or losses of freedom. An example of this would be maybe a senior person that they're not able to drive any longer. They lose some of their independence, some of their freedom, and that can be very difficult for them to process those losses and cope with those losses. Psychological losses, so this could be someone with the beginning stages of Alzheimer's and just realizing that the cognitive effects have began, that their memory is starting to get impacted. They're aware that these losses are occurring. Functional losses, cognitive, economic or financial loss, loss of safety, losses associated with sexuality, existential loss, spiritual loss. So an example of this could be a person who feels like their faith has been shook, that they don't know what to believe in anymore. That can be very difficult for people as well. And also cultural, financial, and communal losses. To lose that sense of community for people can also be very difficult. So loss experienced, these could be primary or secondary losses. Primary losses are things that are kind of obvious. It could be the loss of your loved one that passes away. It could be the loss of a job, loss of an object. The secondary losses are sometimes called hidden losses. Those are losses that are not so obvious. A lot of the time, they're internal losses. So if you lose your job, that would be the primary loss, but that loss of security, loss of the ability to provide for your family in the way that you previously could, those kinds of losses would be secondary losses. There can also be, excuse me, major or minor losses, actual losses versus threatened losses. So an example of this, again, we'll go back to the senior that isn't able to drive anymore. Once their license is taken away, that would be an actual loss. But maybe before this happens, family members are voicing their concerns to the person that, well, maybe you shouldn't be driving anymore. At that point, it would be a threatened loss, but it also creates a lot of stress and worry for people. There can be internal versus external losses, chosen or imposed losses, and also sudden and anticipated losses. So the main thing to consider with these losses are that perception is huge. The way that the person experiences the loss, looks at it, we have to look at it through their lens of how they're experiencing the loss. Okay, so next we're going to look at a picture. It's domains of issues associated with illness and bereavement. So it's from the 2002 model of hospice palliative care. And we will break this down into different categories right after this. But it's just important to note that in the center, where it says patient and family characteristics, it's very important to also look at the impact that the losses and the issues have on the family, as well as the person that has the life-threatening diagnosis. And along with this, the characteristics of the patient and family need to be considered, the demographics, the culture, their personal values and beliefs, the developmental state, and the presence of disabilities as well. So if you look at disease management, that talks about the primary diagnosis that the person receives, any secondary diagnoses, those types of things. Loss and grief, so we have loss, grief, acute, chronic, and anticipatory, bereavement planning, mourning, and we'll just go on to the next slide. We will break down a couple more of these. So looking at physical losses, you have to look at pain and other symptoms, and this is not just pain that the the person with the terminal illness experiences, but the family as well. They're going through a lot of pain as well. Level of consciousness and cognition, function, safety, and aids, motor, so that's a person's mobility, swallowing ability, senses, hearing, sight, smell, taste, and touch, how those are impacted, physiologic, so breathing, circulation, sexual losses, fluids and nutrition. That can be very difficult for people as their disease progresses, their ability to eat and drink becomes impacted. And that can also be very hard for the person's family member to see them struggle with this. Wounds and habits such as smoking or drinking alcohol. Looking at psychological issues. So we have to look at the patient and the family's personality, strengths, behavior, and motivation. If there's a presence of depression or anxiety, emotions such as anger, distress, hopelessness, loneliness, the patient and family's fears involving abandonment, burden, fears of death and dying, control, dignity, and independence. That's often a very big struggle for the person with the diagnosis. Any threat to their independence or threat to their control, it's very hard to adjust to those losses. Conflict, guilt, stress, and coping, and the person's self-image and self-esteem, and how that can be impacted by a terminal diagnosis. So looking at some social issues, we have to look at the patient and family's cultural values, beliefs, and practices, the relationships and roles between family members, friends, and their community, feelings of isolation, abandonment, reconciliation, safety, if they live in a comforting environment where they're able to give and receive support, privacy and intimacy, routines, rituals, and recreations that maybe were very important to them in the past. If they're not able to complete those activities anymore, that can be very hard. Financial resources and expenses, and legal issues such as powers of attorney, advance directives, last will and testament, and family caregiver protection. So now we'll look at some spiritual. So you have to look at the meaning and the value that the patient and family have surrounding their life, the diagnosis they've received, how are they coping, how are they looking at this diagnosis that they've received, and how is the family interpreting it as well. Existential losses, values, beliefs, practices, and affiliations, spiritual advisors, rites, rituals, and symbols. And so practical, so activities of daily living, for example, personal care, household activities, things like that, that can often be a big challenge for families to cope. A lot of the tasks of daily living, like cleaning the house, cooking, those can be very difficult when people are just trying to manage that diagnosis, caring for the person that has the diagnosis, and that lack of support that they have. You have to look at dependents, if they have children, if they have pets, and if they have telephone access and transportation, which definitely impacts their ability to receive support. Okay, so now we will take a look at some of the losses that the pandemic has created for people. So this is a time where everyone is experiencing grief right now. We're all grieving the lives that we had before the pandemic. And we'll just go through a few of these, and I'm sure a lot of these will resonate with people. So strain on relationships, uncertainty of when things will go back to normal, illness and long-term effects of COVID, loss of control and freedom, loss of people's routines, loneliness, online overload, unable to plan or anticipate their future, financial difficulties. Lots of people are losing their jobs or not able to work as much as they were previously, and that threat to provide for themselves and their families can be very stressful. Less able to utilize coping strategies, less social and practical support, experiencing worry, guilt, loss of homework boundaries, feelings of missing out, loss of anticipated future, feeling stressed and overwhelmed, loss of alone time, or having too much alone time for those people that maybe live by themselves, reduced social interactions, exhaustion, and grief. So a lot of challenges going on right now for everyone. Lots of universal grief going on right now. So what we're seeing from the pandemic is this death-denying culture shift. In Western culture, people often don't think about death and dying unless you're in that experience of having a loved one with a terminal diagnosis or yourself being diagnosed with a terminal illness. Right now, death and illness is at the forefront of everyone's mind. So this culture shift is really impacting people's mental health. So we're not used to having these thoughts on a daily basis. This universal loss and feelings of grief and the stress and impact it's having on people's mental health right now is huge. Threat to people's assumptive worlds. So this involves the feeling as though the world is benevolent, so that the world is a good, safe place, that the world is meaningful. So just thinking that the way that the world works makes sense to us, and also the self is worthy. So from facing the pandemic, a lot of people's assumptive worlds are being challenged right now and feeling like the world is not a safe place, that things aren't making sense, things aren't the way that they used to be. And all of these impacts on mental health is creating a lot of self-worth issues, self-esteem issues. So people are definitely struggling right now, and that's universal for everyone. So all of these losses from the pandemic that we just talked about are universal experiences for people. But for people that are experiencing this, plus the experience of being diagnosed with a terminal illness, living with a terminal illness, so I just put appointments and traveling. A lot of people's appointments right now are being canceled or postponed. Fear of traveling to these appointments, fear of catching COVID, those are all real threats for people. Caregiver stress on loved ones. So a lot of role changes when someone is diagnosed and when they're experiencing health declines, and families often have a lot of difficulty adjusting to these role changes. Increased demands on caregivers and lack of supports that they're experiencing. Client and family are experiencing a lot of worry and just in general lack of supports from family and from community professional supports. Being isolated and not being able to see our family as often, that normally would have provided a lot of support and a lot of respite for the person's main caregiver. So a lot of challenges going on. Client and family are experiencing a lot of emotions of guilt, anticipatory grief, like we talked about, and ultimately the death of their loved one and experiencing that grief. So all of the stressors plus all of these very difficult situations is impacting people's ability to cope with the pandemic. Loss impacts on hospice care amid the pandemic. Patient, family, and hospice workers all experience these losses. The pandemic complicates normal grief and loss experiences at the end of life. So, hospice and palliative care aim to provide an interdisciplinary approach to grief, addressing the mind, body, and spiritual needs for patients and their families. But during the pandemic, a lot of these resources are impacted negatively, that we don't have the resources that we previously had. Um, for example, at the hospice, we used to have a lot of family members in visiting patients all the time. We would plan parties for birthdays, for special occasions. We would have a lot of legacy work and support for the patients and family going on normally at the hospice. But a lot of these resources have been impacted by the pandemic. And it's very difficult for the staff members as well to adjust to these losses. So just some of the other examples from the pandemic, people have to think about the isolation period that goes on once somebody is admitted to the hospice. Thinking about visitor restrictions, very, very stressful on the patient and the family, having to decide who is able to visit and who is not. That can create a lot of family conflict as well, and a lot of guilt on the person that is admitted to hospice. Patient and family attitude towards hospice admission. This has definitely been impacted just because of all of these policies and restrictions that the family has to consider before making that choice to have their loved one admitted residentially to the hospice. So what we're seeing is patients and families are choosing to stay at home longer. And this can create a lot of tension on the caregivers. It can create a lot of caregiver burnout. Uh, Once the person is admitted, their health is often declined a lot further than they normally would have been. So it's a lot of extra stress and a lot of work for the family and the patient. Often they're depending on home care to provide these supports, and we know that home care has been impacted very heavily right now with shortages in workers, and that creates a lot of stress on the patient and the family as well. We've had the loss of hospice volunteers. Unfortunately, we would depend on our hospice volunteers for things like covering the reception desk, helping out the nurses, sitting with patients and visiting with them, serving the meals. So that loss has created a lot more work for the staff and really makes it so that the frontline staff have less time to interact and provide support to the patients and families. And also the impact that the pandemic has had on the community programs. So we have community programs for the person that has the palliative diagnosis, caregiver supports, and these would often be in-person supports. So these community programs have had to be readjusted, and a shift towards virtual supports, which can create a lot of barriers as well for certain people. So many aspects of the loss may lead to family members experiencing complicated grief. Complicated grief is a response to a loss that is more intense and prolonged than usual and affecting one's ability to return to a new normal. So complicated grief, it is these intense emotions of grief that tend to not reduce over time. In some cases, these emotions get more intense through time. And it's hard to put a time limit on things like this, but people usually would say between 6 months to a year after the loss takes place, if the loved one is still unable to perform daily tasks that they would have been able to previously, if their emotions are still very intense as if the loss had just occurred, then normally this would be considered complicated grief. Some of the risk factors for complicated grief can include a sudden death, unexpected death, a death that is traumatic, multiple losses occurring close together, concurrent stressors going on, high dependency on the deceased, and substance abuse as well. So a lot of the stressors and issues created by the pandemic can also cause complicated grief as well. So we're seeing that caregivers are struggling with the isolation during quarantine. They're not getting as much support as they normally would be from the community, from professional services. A lot of impacts on the support and the isolation that they're experiencing. People are experiencing a lot of financial stress, so worrying about finances on top of grieving for their loved one, that can create some complicated grief as well. Not being able to be with their loved ones during the illness journey and during their end of life journey, that can be very difficult for people to process. And less accessibility to palliative team members. So in some cases, the social worker might not be working on site. Chaplains or priests coming in, that might not be available for people, and home care being impacted like we discussed already. So the coronavirus complicates the grieving process because family members may not be with their loved one at the time of death. They cannot grieve together in a culturally appropriate manner that they would have been able to previously. In the bereavement period, Western culture, usually people are given about 3 days off of work, normally spent to arrange funerals, burials, celebration of life, ceremonies, death rituals, and then we're expected to return back to work, back to normal sort of thing. So this already is very challenging for people. But with the pandemic restrictions, we are seeing people are unable to have these experiences as normal. A lot of clients that I'm working with have postponed funerals for their loved ones because they have to restrict how many attendees. They're not able to have the ceremony in a way that they would have liked to, so they're choosing to postpone. And this leads to lack of support, delayed grief, worry, and guilt. So some people just feel like they're not able to work through their grief until these rituals take place. They're feeling like, when am I going to be able to have this ceremony? They're having a lot of guilt because their loved ones aren't being commemorated in the way that they think they should be, and a lot of worry that maybe once the rituals do take place in the future, that they won't be attended to in the same way they would have if it happened after the initial loss. Maybe unresolved family issues or cause them. So the process of choosing essential visitors can create a lot of family tension and create a lot of barriers in communication. And guilt surrounding caregiver and end of life journey. So a lot of the times, caregivers, once their loved ones pass away, they might experience some relief just because the burden on them is so high as a caregiver that they're not able to get any rest. And sometimes after the death takes place, there are some emotions of relief. And a lot of the times these caregivers feel very guilty about having these emotions. And just overall increased isolation and lack of support. Impacts of COVID-19 deaths on family and healthcare workers. So in the case where their loved one actually passed away from COVID, these losses are often very unexpected and very sudden. So an example of this would be someone that might have had COPD, those illness trajectories are usually very long, but if that person ended up catching COVID, they they would have died a lot earlier than the family would have normally expected them to. So it's very unexpected, and a lot of grief, complicated grief, can occur from these situations. Families may not have they may have the inability to say goodbye to their loved ones, and the inability to spend time during their last days, weeks, or months of their lives. Unable to be present at the moment of death. And those issues are not just related to people that die from COVID-19, but any loss that takes place. This is a huge worry and a huge stress for family members to not have that opportunity to say their goodbyes and to spend time with their loved ones. And on healthcare workers as well, they're witnessing serious illness and death, patients dying alone. Sudden decline and frequent deaths provide little time for workers to process all of these losses. And overall, a lack of support for staff members and staffing issues creates a lot of stress. So what do family caregivers want when they are grieving, and how is this impacted by the pandemic? So we see that families want honoring loved ones' wishes, and a lot of the time with COVID-19, if the person has COVID, their health declines so quick that sometimes the patient wishes aren't able to be communicated and aren't able to be followed as wished. So this can be very difficult for the family to process this. Families want to be included in decision making. They want support from the team, but as I said before, a lot of the time, the normal team members aren't available, such as social workers. Honesty and transparency, and what we're seeing is a lot of the time communication with the family can be hindered if they're not able to actually be present. Sometimes it can be difficult to communicate any changes in health to all of the family members. So we're going to take a look at a video that I found, and I'll just read this little description. Stuart Hamlin urges people to stay inside in an emotional video filmed hours after his mother died from the coronavirus. He describes his pain just 4 days after Tracy was admitted to hospital with COVID-19 symptoms. And in quotes, losing someone is hard enough, but not being able to hold your family close when you do is the most gut-wrenching pain I've ever felt in my life. So we're going to take a look at this video, and just to let you guys know, there's some very strong emotions in this video as well.
I'm doing this because I want people to understand that this virus, this corona, it's not a joke. You know, I've made jokes about it. Everybody makes jokes about it. I think that's how we deal with it. We make light of hard situations. But Monday, her mum got taken to hospital, Q&E. It looked like it was this corona. And me, my dad, my brother and my sister, and all their family have to just sit at home while she struggles in hospital on her own. And you can't go near her, you can't cuddle her, can't take her anything. And you're praying every day that she's going to come out, that she's going to be all right, everything's going to be okay. That was Monday. Now it's Thursday, and she's gone. She's gone. Just like that, it's gone. We can't grieve, we can't comfort each other, we can't hold each other. losing someone's hard enough, but not being able to hold your family close when you do is... This is the most gut-wrenching pain I've ever felt in my life. There were so many things that I had left to do and say that I didn't get to do. I'm just... Yes, people have got to start realising this fucking thing ain't playing anymore. This is serious. I know loads of people have died, but it ain't until it's a bit closer to home that you realise how fucking dangerous it is. I love you, Mum.
Okay, so very heavy video there, but that kind of gives us a glimpse as to what these caregivers and family of these people are experiencing during the loss of someone from COVID. So I just made some points of what he mentioned there, that the loss was unexpected. She may have went into hospital with mild symptoms. He mentioned the loss of control and feeling helpless, that he wasn't able to provide her support and other family members to provide them with support as well. Lack of communication, not being able to talk to his mother and his family, inability to support or touch, the quick decline in death that they experienced, the inability to say goodbye, inability to grieve with their loved ones, and the stigma that is attached to some people's attitudes towards the pandemic, towards the validity of the pandemic and the validity of these losses. So now we're gonna shift to talking about supports for people experiencing these losses. So accepting and receiving support is the most important factor in determining a positive grieving outcome. And ideally, the person who's grieving can receive support from personal support, such as family members and friends, but it's recommended to receive a combination of this with also some professional support as well. Supports are critical before hospice admission and the death of their loved ones. So community supports, caregiver supports, very important, and that impacts the grieving process that they have once their loved one passes away. Pandemic is creating barriers for in-person supports, so it's needed to shift those supports to virtual. So just looking at some of the things we do here at Carefor Hospice Cornwall, providing ongoing supports to client and family before the hospice admission. This can be done through weekly phone call check-ins with the patient and the family. And this is really essential for learning about any unmet needs that the patient and the family is having, any health changes that the patient is experiencing, looking out for caregiver burnout, those types of things. And once we get those updates from the patient and family, to communicate those needs with everybody on the hospice team and provide supports as needed. So home visits with protective equipment when appropriate. Advanced care planning. This is very important right now because, as I mentioned before, when people are being admitted to hospice, it's often at a later point than it normally would have been. So the patient's health has declined drastically at that point. So it's important to make sure that the family has things set up before they come to hospice, ideally. So the power of attorney documents, assistance with completing those, any assistance that might be needed with setting up funeral arrangements, their wills, and any caregiver benefits that might be needed for the family members. To look at legacy work before the person comes to hospice. This could be assisting the patient with writing letters to their families. We do something really cool here with legacy videos where we can film the patient answering questions about their lives, their accomplishments, their experience growing up, and eventually share this with their family members so that they can have that as a keepsake. Providing one-on-one support and patient and family supports as needed. And there's also been a need to shift from residential care to a combination of home and residential direct patient care. So like I said, the shortage of home care workers, a lot of these unmet needs for families and patients are the direct patient care. So the hospice has made a shift to provide those home care services when their normal home care agencies aren't available to do so. And also virtual support programs for palliative community clients. So we have shifted our community programs from being in person to mainly virtual. So providing the palliative clients with the opportunity to connect with other palliative clients to discuss and support each other. We're doing a lot of virtual calls with them, as well as caregivers, and also the grief supports as well. So these are just some questions that are very helpful for assessing the patient and family situation. And again, this would ideally be asked before the patient is admitted to hospice while they're still in the community in their own home, to find out more about the patient and family and what needs they have. So just some general assessment questions that would be: who are individuals in the family? How has the disease affected day-to-day living and relationships? How do members of family communicate with one another or with others? What is their understanding of illness and bereavement? What is most important to them right now and in the future? So that's really important for identifying goals of care. And what are they most afraid of about dying, death, and bereavement? These are some strength-focused questions. So what do people say in regards to their strengths, capabilities? How do they describe themselves? What is working well right now for the patient and the family? How did they cope in the past with loss and stress? What does this experience mean to them? What beliefs, values, practices sustain them? How is the family managing? What is working and what is not working as well? How are they managing other health issues? This can be very difficult when the patient's main caregiver also has their own health issues going on. That need for extra support is definitely there when that's the case. And what do individual and family find, so where do they find support at present? Some risk-focused questions. What is distressing, worrying the individual or family right now? How do they assess their own risk? What unresolved losses do they have? Are they dealing with multiple or concurrent losses? Are there any culture or social taboos or pressures in play? Are there conflicts within the family or complex relationships? Is addiction an issue? Is there history of mental illness? Does the person's or family's lives have meaning? What about hope? Does the individual or family feel connected spiritually, socially, or emotionally right now to others? And also some practical needs questions. What practical assistance does the individual or family need right now? Based on the disease trajectory and the palliative performance scale, what about the near future? What are the needs in relation to finances, estate planning, funeral arrangements, decision-making, and living arrangements? Does family need additional emotional support? What connections with other services and health providers are there right now? And what other resources does the family need right now? So while the person is in hospice residential care, before admission, it's very important to make sure that the patient and family are aware and understanding of the policies and restrictions created by the COVID-19 pandemic. So all of the restrictions need to be communicated very clearly with the patient and the client so they're able to make an informed decision about whether or not they're going to be admitted to hospice. So things like screening, visitors coming into the hospice every time must be screened and pass that screening to be able to come in. Visiting and visiting hours, so identifying who the main essential visitors are going to be and the visiting hours provided. Discussion of the isolation period and that any visitors going into the room would need to be wearing PPE. If there are any changes in policy regarding COVID restrictions, COVID policies, if there's updates in policies, make sure the patient and family are notified as soon as these occur. And that would mean calling different family members and letting them know of these changes, ideally before they're put in place. For example, if there's going to be a change in visiting hours. Keep family updated of health changes and encourage family to check in at any time for updates. So if some of the family members are not able to actually come in and visit, make sure to keep them updated on any health changes and encourage them to phone in at any time. The hospice is a 24/7 facility that's open all the time for them to call and get updates and just check in at any time. Encourage virtual visits with family members. We were pretty lucky this winter that it was pretty mild up until recently, so we were able to have a lot of window visits with family members, and we also have some tablets at the hospice to have virtual calls with family members as well. So it's important to let the family know that these are options for them. Offer continued support to the patient and family, to always check in with them. Things can change from day to day, so it's very important to check in and communicate any changes with the whole team. And to remember that patient comfort and holistic care are still the main objectives for us. So while they're in hospice residential care, try to facilitate conversations when appropriate, such as reminiscing, storytelling, and the opportunity to say goodbye. Provide reassurance that their loved one is being well cared for, checked on often, and support is being given to the patient and the family, especially for those family members that aren't able to come in and visit. Allow patient family to verbalize their fears, feelings, and frustrations. That's absolutely valid that patients and families are frustrated with a lot of the COVID-19 restrictions taking place, as are staff members as well. So it's important to allow them the opportunity to vent and communicate those frustrations. If possible, seek help from interdisciplinary team members, for example, social workers, spiritual leaders, to provide the patient and family with supports. And continually assess family needs. Like I said, things can change day by day. And if you notice any changes, to provide extra support as needed. So for grief support, uh, it's important to have phone call check-ins with the family members after their loved one passes away. Uh, Make sure that you check in with family members regularly and ensure that they are notified of the different grief supports and encourage them to participate. So here at the hospice, when someone passes away, we make a call to them about a month after the loss takes place, sometimes sooner than that, depending on the situation, just to notify them of different grief supports, to check in and see how they're coping, and allow them to vent or communicate their struggles with you, and encourage them to participate in the grief supports to at least try them out. Take note of vulnerabilities. So, is the grieving person a senior? Do they live alone? Do they have minimal supports? Are there any mental health issues? Are they at risk of suicide? In these cases, they may require more frequent check ins and referrals to other community resources. Provide one-on-one support through virtual video calls, phone calls, home visits with full PPE as needed, provide ongoing family support, and to notify them that there is a virtual bereavement support group that the hospice facilitates biweekly. So people can participate in that and also on one-on-one supports as needed. So it's important to remember that hospice programs offer bereavement support even for those whose loved ones were not connected to hospice services. So they may not have been connected with hospice supports at all. Those people are still able to receive bereavement supports through the hospice. People who are admitted to hospice, their family members can receive bereavement supports, as well as people who may have benefited from hospice community supports, but do not end up passing away here at the hospice. So the grief support services are available to anyone, and those services are free. And also to refer to private counseling, physicians, or other resources as needed. So when we're looking at virtual supports, it's important to find out which method of virtual support clients are most comfortable with. So it's important to explain all of the different options that we have and allow them to pick which works best for them. Some clients may not have access to technology. For example, a senior may not have a computer or feel comfortable with video calls. So in those cases, phone calls might be better suited, or even a home visit with PPE. Intake information, so it's very important to get the client contact information, emergency contacts for the grieving person, their address, their phone number, their email, get as much information as possible. It's important to be flexible with scheduling these supports. Some people may be working full-time and would need a later appointment. So it's important to be flexible and work with their schedule. If they do not show up for a meeting, very important to follow up with the client to check in and make sure everything's okay. If you're not able to reach them, then that might be an example of when you need to contact their emergency contact. And if the person is initially not interested in the grief supports, it's still important to follow up with them to check in maybe a month or so later, because people's grief changes throughout time, and maybe later on they might really be in need of those supports. So initially, if they say no to any of the services, definitely follow up with them again to see if they might need them. And also to take client privacy and their environment into account. So maybe they don't have privacy at their home. They might live with other people and not feel comfortable talking to a grief support worker in their own home. So it's important to make sure that the client feels comfortable in their environment to receive those supports. And also very important to have any intake paperwork filled out, such as consents to services, client confidentiality agreements, and if you are using virtual services, a consent to have the supports received through that method as well. So supporting those who are grieving, just remember that everyone grieves differently, but most grieving people value being alone at times, yet having company at other times. The opportunity to express feelings, the opportunity to tell and to retell stories of their loved one, whether that's stories from before they got sick and passed away, or stories throughout the caregiving journey. Is very important for clients to retell those stories because that allows them to process what has happened. Information about what is normal. A lot of the times people just need confirmation that what they're experiencing is a normal reaction to grief. People may feel like something is wrong with them, that it's not natural, the emotions that they're feeling. So to just normalize those experiences is really important for people. To provide the gift of your presence, permission for the grieving person to be self-absorbed, to allow them to talk about whatever they need to talk to. Permission to laugh at times. A lot of the times people feel a lot of guilt for feeling happy or for laughing. So it's just to normalize that you need to have those positive emotions too, that they shouldn't feel guilty for feeling those emotions. Permission to experience a roller coaster of feelings, and assistance with basic needs. So supporting those who are grieving, I would say that the most important thing is to listen to what they're saying as well as to what they're not saying. So active listening is very important. Avoid judgment and avoid giving advice for how they should be handling things. It's their own journey. Acknowledge the pain that they're in. Normalize their feelings and experiences. Importance of coping strategies and self-care. To reassure them that there's no time limit for grief supports, that these supports are available to them throughout the grief journey. There's no time limit. Work at the client's own pace, and clients are the experts in their own grief. Tasks of mourning. So 4 generally recognized tasks of mourning: acceptance of the reality of the loss, experience of emotional pain and suffering, adjustment to living without their loved one, and to find an enduring connection with the deceased while embarking on a new life. So that continuing bonds theory of grief isn't just about forgetting and moving on from the loss. And all of these tasks are not sequential. Each person moves through these tasks differently. And so as a supporter, healthcare workers are experiencing many losses in addition to patient and family losses that take place. They're losing the ability to give the care they're used to providing because they're short-staffed, have limited time and resources, medications, and equipment. They have to deal with the fear of contracting COVID-19 and possibly exposing their family. Some healthcare workers have experienced the death of their coworkers or family due to COVID-19 exposure, and as well personal losses related to the pandemic or not. And to be aware that all of these factors create a high risk for burnout. So self-care definitely has to be a huge priority for us right now. As healthcare workers, we always encourage caregivers and clients to engage in self-care, but it's important that we also practice what we preach. So self-care, that is what will reduce the likelihood of burnout. So if you just take a look at this, 50 ways to take a break, just look through and identify self-care tasks that are suited for yourself. And don't be afraid to seek out support when you need it. Seek out support from your team as well, and reach out to any employee family assistance programs that you might have through your work. As a bereavement support worker, it's also very important to touch base with your volunteers to make sure that they're doing okay as well and provide supports to them as needed. Okay, so that's all I have for my slides. So as I mentioned at the beginning, the questions and discussion opportunity will be taking place at a later date, and Jenny will communicate that date with you through email along with the recording of this workshop. So I want to thank you to everyone who participated in this workshop. Following the discussion that we have, Jenny will be emailing a short survey to get your feedback and interest in other topics. I believe the survey will be through SurveyMonkey, so please check. It might go into your junk mail as well, but following the discussion, the survey will be emailed out to everyone. And I just have my email contact there if anyone needs to reach out to me directly. Okay, so thank you so much, everyone. Looking forward to the discussion.